It's the same concept over and over and over. I'm just asking it different ways. But again, draw them out, because I'm telling you, as you saw, almost half the people got turned around, okay? Start with what you know, work your way backwards. Obviously, you have to know the physiology, right? But this is physiology that I reminded you guys of. I didn't teach it to you. This should have been 202, okay? And if you didn't get that, then again, that's why we have office hours. That's why we have content clinics, or whatever they're called nowadays. What do they call it? Explore Mores. We used to call them study groups when I first started. But what do I know? Okay. Anyway. Okay. Any other questions? Did that make sense eventually or not? No? Again, this is one of those things where just come talk to us, and once you get it, it's like, oh, okay. Like, a lot of things in PATH are like that. A lot of things. You're like, that doesn't make sense, it doesn't make sense, it doesn't make sense, and you get it, you're like, oh crap. Really? Was that easy? Yeah. It's just, that's how PATH works. Very concept-based, where once you get it, you got it, and you're like, oh, okay, fine. Should have been thinking about that, or should have been stressing that part. Okay. All right, so that whole sodium discussion should have made this potassium discussion again. Probably not new information for you. Okay. In fact, I'm pretty sure this is straight out of. Geez, maybe 201. Okay, again, potassium is that other one, right? It's not the sodium, it's the other one. It's on the other side of action potential. It's the one that's causing the hyperpolarization in the action potential. It's the one that's primarily inside the cell, okay? It's the one that's getting kicked out when aldosterone pulls sodium back in, okay? Okay, again, there's just some ways that you can not have enough calcium on hypokalemia part. That alkalosis thing, this is kind of leading somewhere, okay, because next week is actually our acid-base one, okay? And we'll also talk about like diabetic ketone acidosis. Okay, those ketones are acids. This is kind of a key point right here when we talk about that part of it, okay? We mentioned it here. It's more applicable later. But if that extracellular fluid is greater than intracellular fluid, then we would call that hypokalemia, because you have more potassium outside than you do inside the cell, okay? Here's the thing is hydrogen, right here. If you have a problem with too much potassium running around in your blood, then hydrogen that was inside your cell will actually kind of do like an exchange with it, right? And that goes both ways, okay? That potassium hydrogen will back and forth exchange each other, all right? So this is actually the exact opposite of what happens when you have like diabetic ketoacidosis. In this case, that actually as you have alkalosis, and again, we'll get into that later. The important part is you just understand that that can happen where hydrogen, potassium, the other way around, will actually exchange with each other, okay? And these hydrogen atoms are acid, right, like HCl, okay? So that's kind of important that at least you recognize that at this point, because it's one of those mechanisms that is going to explain a little bit later on. Okay. All right. So again, examples, right? Yes, if you are taking some diuretics, as in a medicine, like, furosemide or something like that, Lasix, that some of these diuretics will actually work by reabsorbing sodium or increasing aldosterone, right? If you increase aldosterone, you are reabsorbing sodium. However, guess what? You're getting rid of potassium, right? So that sometimes does happen. That's why they make potassium sparing diuretics, which are diuretics specifically designed not to kick out all your potassium. Okay? All right, so let's see if this makes any sense. Muscle weakness and cramps. Okay, if I don't have enough potassium in my blood, why would I have muscle weakness and cramps?
Because it affects your soluble potential.
Ah,
You don't have action potential.
it's gonna mess up your action potentials, right? There's, believe it or not, a lot more to that. It's a lot deeper than that. And on one of your homework assignments, questions, it asks about that. It actually asks about all of these electrolytes. This is one of the ones I'm telling you, hyperkalemia. That's one of the ones you're just gonna wanna look up because the details on that are something you would not probably guess, okay? Let's just put it that way. The way it actually works, for now, we'll go with it messes up your action potentials. We'll talk about it later in more detail when we look at the homework. But just look it up, okay? Because again, that book's not even close to explaining this adequately, okay? How about this question? Why would you have a shallow T wave on an EKG with low potassium? That's your normal EKG, right? P, Q, R, S, T wave. Why would that T wave be tiny or shallow? Okay, there's a couple ways to look at this. One, you can just memorize that this big stuff on the EKG, that big stuff on the EKG, that's your ventricles because they're big, right? And that little thing is the atria. Actually, that doesn't help you memorize this. Forget it. What? The other way to help you memorize that is when you're having your action potential thing, okay? Starts down here in negative something, depending on what you're talking about, whether it's a nerve or a muscle, right? And then it goes up, right? That part has to do with what electrolyte as it shoots up? Yeah, that's when those sodium-gated channels open up and sodium is rushing into the cell, brings its positive charge with it, makes your cell go more positive, right?
Yeah.
Okay? On the other hand, when this happens, oh, and by the way, that's when it also you're having this ventricular depolarization, right? Okay? When you're having that whole repolarization kind of thing, now we're on the downswing, and that's potassium, because now potassium taking its positive charges and leaving the cell. Okay? Well, if you have positive charges and you leave the cell, your cell becomes more negative, doesn't it? Okay? Again, that's an action potential. But potassium tends to overshoot. Yes?
Mm-hmm. Yeah.
Okay? And if you look at this, that's the effect of potassium, right? And that looks exactly opposite of this T wave. So I think when it's tiny, I'm going to also have a tiny T wave. Again, it's probably way oversimplifying, but it kind of works in my head, at least for that particular thing. That it says the shallow T wave. And you're like, but why are you telling me this? Okay. I don't know why, because I've actually never seen it in a hospital. I've never seen a nurse read an EKG. However, I do know that my daughter was sitting up there over the weekend asking me to help her read EKGs. She's in block 4 of GCU nursing school, and she has to learn how to read several. I think there were like 10 different scenarios of EKGs. Apparently that's part of your program, that you have to know a lot of these EKGs. Okay? So, yeah. I don't know why you have to know, but you do. Okay? I guess I run out of things test. And besides that, I mean, again, you're going to be spending the vast majority of the time with these patients. You know, you're going to be spending days with them. Doctors are spending 10 minutes a day with them. Okay? They're going to ask you a lot of stuff, and it's always nice to be able to answer. Right? So anyway. Okay, on the other side of this, if you have too much potassium again, there's a good chance you ate too much potassium. Okay? That certainly happens. Or of course, you got lost it. Okay? Some reasons. Yeah, we'll get into that last next week. Alright? Renal failure. Okay? You have too much potassium in your